Thank you for joining us on Health Diary. My name is Gladys Gachanja, and today we're coming to you from the 4 Points by Sheraton here in Hurlingham. Now, rare diseases are a reality of a few, but the impact is immense. One of those rare diseases is spinal muscular atrophy, abbreviated as SMA. Now, the most severe forms of this disease affect children, leaving the caregivers with such a huge responsibility to care for their fragile lives. Today, we find out more about spinal muscular atrophy right after this fact of the matter. Spinal muscular atrophy, abbreviated as SMA, is a genetic disorder characterized by weakness and wasting in muscles used for movement. When your child has SMA, there is a breakdown of the nerve cells in the brain and spinal cord. The muscle weakness in this condition usually worsens with age. There are different types, and the severity depends on the type of SMA. There is no cure for SMA, but treatments can improve some symptoms and in some cases increase the lifespan of a patient.
Want us to freshen her up because she was asleep the whole night so that she can have a productive day ahead. She loves her massage. Mama?
Yeah, that feels good. Yes.
So now I need to clean her trachea. Okay. I'm gonna remove this. So at night I normally change the whole thing. I change even the tracheostomy. I'm looking at the oxygen to see if she's saturating well, so that I know when to put back the vent. And I'm done. This is a peg tube, and this is where we eat from. So I just clean the sides. You can hear that sound. It means she has a lot of secretions. So I have to suction her. Mama, it's going down. This is yogurt, like I said before. This is where we eat from. So I use this. I connect this. I connect it into the feeding tube and lock. I make sure there are no bubbles, and then I feed. So I give her 4 of this, but with her recent pneumonia, we're trying to wean her back slowly. So I'm going to give her 3 and 1 syringe of water, and then I feed. There is no coming out of the state. Even the drugs that are there is none that will totally reverse the condition she's in. And we're gonna need a nurse, we're gonna need an ICU at home, we're gonna need so many things. And I feel like it was more of a sacrifice from my end. Focus on her, take shifts with the dad. And yeah, so far, so good in terms of my social life. Of course, there are those days I feel overwhelmed. My husband and my lovely mother-in-law, they step in at times when they're not around. Now we can easily hire a nurse, even if it's for a day or 2. Go out there, do something, and then you come back with renewed energy to look after her. Home care, in as much as it's a cheaper option as opposed to being in the hospital, it's equally so expensive. And more so when I am not working, the dad is not working. In reality, if I'm to switch off the machine, it's just a matter of time, and she'll get tired and she'll go. With the government, they can help us offset bills for our electricity and maybe make it a little bit convenient for us.
Spinal muscular atrophy. Let's understand this condition better, and to help us do so, Dr. Sam Guer, who is a pediatric neurologist at Getty's Hospital and of course a lecturer at the Kenyatta University. Thank you for your time. And we have Ruth Wamboi, who is an SMA caregiver. Thank you for joining us. Daktari, we have defined what SMA is. What causes the wasting away of muscles brought about by this condition?
First of all is to understand that your nervous system is sort of like the cabling, the electrical cabling in your body. It passes information from one part to another, and you have these two distinctions, the central nervous system and the peripheral nervous system. The central one is the brain and the spinal cord, and then reaching out to the rest of your body are the nerves that extend to your muscles, to your organs. Now, the same analogy can be with Kengen and the high power voltage, and then the transformer and the last mile connectivity being the muscles that are connected. And what happens with the SMA, clearly, there is a gap in the way the nervous system supports or connects to these muscles. And without ability to function, therefore, the muscles waste away.
Okay, it is described as a genetic disorder. Does this mean we can totally rule out the influence of environmental factors?
To understand that, we appreciate that genes code for the way your body is made, for the different components of your body. And essentially is that this particular gene that is responsible for making the muscle that connects that electrical cabling we've talked about is lacking. And that's essentially the problem. Environmental issues just come in to alter the course of the disease, like having an infection, as Mama Nila will explain, and essentially any other thing that will affect your functioning in the environment.
In your family, do you have members with any neurological condition, or baby Naila was the first one?
Like Dr. has explained, when it comes to it being genetic, it's both me and the dad. We possibly have the defect gene, but boiling down to our family, in my family, we've never received a case of any SMA, and same case with the dad's side. Yeah, so Naila is the first one.
How was your pregnancy?
Very much normal, for lack of a better word, but Naila was not kicking as much as, you would see other kids or other moms saying, you can see my kid kicking. That was never the case for me. It was just mild touches. It was just like she's, testing the waters. It was never strong kicks, yeah.
And how long after birth did you get a diagnosis?
She was born a bit floppy. Yeah, she cried at birth, but she was a bit floppy and weak. So we were so concerned about how she was achieving her milestones and also how she was gaining her weight. She was gaining with grams and grams every other month, and also in terms of bearing the neck, that was never the case. So at around 8 months of misdiagnosis and not finding out what the problem is, we were advised to go to see a neurologist, and that's when we got to know. We did the test only for us to get the results when she was 1 year. That's now when we fully knew it was SMA.
Okay, Daktari, she describes her pregnancy, and even during pregnancy, something was off, as far as the kicks are concerned. At that point, could a doctor pick out something is off?
Obviously, there are many conditions also that may manifest the same. Anything that will interfere with the way your muscle functions or the electrical activity works or will suppress the baby in any way may cause that. So although they are important signs, they are what we'll call non-specific. Yes, you need a high index of suspicion. And depending on the severity of the illness, then you can see that the more severe it is, the earlier the manifestation. So in her case, she started experiencing those symptoms. I guess she wasn't aware, but from much early on.
Yeah. And we've defined SMA as a rare disease. Now, how rare is it in Kenya for you, Daktari, from experience?
Well, we don't have a complete data because of miss or underdiagnosis. But in general, globally, we understand that every 1 in every 10,000 live births will have SMA. And in the Western countries, it's one of the commonest genetic diseases after cystic fibrosis.
So this in itself would actually set the stage for misdiagnosis.
Yes, and you know, we are a developing country, so some of the diagnostic capacities are yet to be available to us. Accessing a neurologist is a challenge, so there are all these challenges associated with making a proper diagnosis early enough to be able to offer appropriate care.
Mm-hmm. And you talked about misdiagnosis all the way up until she was 1 year old. What were you told she might be suffering from?
The first time we were told lack of enough vitamin D. We treated that. Then we were told mild CP. We commenced on occupational therapy. After she got her first infection and was admitted, that's when we got to know it was SMA.
And speaking of diagnosis, baby Nella has SMA type 1.
Yeah.
And what does it come with?
Wow, type 1 comes with a lot. You may never get to see your kid sit, and you're living with a deadline, so to speak, of around 2 years or 18 months to 2 years. And also, within this given period of 18 to 2 years, it's a whole task in that there's so many things you need to do to make their life better, to make their life quality, because there's nothing much that can be done. Yeah, so it's just a matter of making the 2 years, I am quoting because we are 3, the 2 years given by the scientists or the doctors, a life quality.
Dr. There are different types of SMA, all the way from 0 to 4. Type 1 is more common. Why is it so?
Type 1 and type 3 are more common. It's a spectrum, and the understanding is that whereas we want to put them in those definitions or classifications, you never quite get one patient who's exactly the same as another. And it all depends on just how much of that connectivity is missing, what proportion of it. So in SMA type 1, you have really a complete or severe deficiency of that particular protein that is responsible for that connectivity.
So what informs the different classifications? Again, severity?
Yes, severity. How early the manifestations start. So obviously type 0 is a child who has those symptoms right during pregnancy and comes out very, very weak with the joints fixed together because of the weakness. And then type 1 will happen in infancy with the initial manifestations, like in our case, respiratory challenges, and it progresses. So type 2, 3, 4, it becomes later and later.
The life expectancy for type 1 is 2 years. Was this clear to you from the get-go when you got diagnosis?
Yeah, it was. In fact, I had a very straightforward doctor, and I would appeal doctors to do the same, because they gave me the strength to know what I'm battling. He told me I have 18 months with a kid, and he literally told me to start saying goodbye to my kid. But it didn't hit. We were discussing with the doctor, when you're given a diagnosis, you tend to avoid thinking about it, and you assume maybe it was wrong, maybe they were wrong. So when we got to 2 years, I was like, it was definitely a misdiagnosis. Yeah, because she got stronger for some reason.
And how is she doing today?
Unfortunately, that only lasted for a few months, but she then started deteriorating, of course, because of the nature of the condition. So as at now, we are supporting her with a ventilator because her muscles got weak and weaker, and it affected her breathing system. And what we are just doing, we are, like I said, giving her a quality life and extending it for her. Yeah, because it's one thing to do that, and it's another to think about the death. Yeah.
Okay.
Yeah.
All right, Dr. The life expectancy for the 4 SMA types varies, 0, 1, and 2 having the shortest lifespan, and then 3 and 4 seem to have a normal life expectancy. Again, why?
It's just got to do with how much of this crucial protein is lacking in your system. And the big complication that happens with children with SMA are respiratory illnesses. Like she's explained, they are now on mechanical ventilation. And because that means everything, breathing means everything, when that is impaired in a big way, then yeah, life is cut short pretty soon. If like type 3 may have challenges going up the stairs, but they are okay, you know, moving on a horizontal surface. Their illnesses may start in the first, second, or third decade of life. And in type 4, their illness will start manifesting, say, in adulthood.
Oh, really?
Yeah.
But did you live a life of symptoms?
Maybe mild. Yeah.
Baby Naila got to 2 years. Instead of deteriorating, she got stronger, then deteriorated after. What would explain that?
When you're told 2 years, it's an average estimate. So people will stretch it longer, and the others will be dead by 6 months.
Oh, wow.
Yeah.
When we come back from the break, we understand the fact that it doesn't matter how much your child is affected, it does not affect the intelligence. Daktari and, of course, Ruth will tell us their experiences right after this short break. Stay with us. Welcome back to Health Diary. My name is Gladys Gachanja. Today, the conversation, SMA, spinal muscular atrophy, Ruth, who is a caregiver, and of course, Dr. Guer, as we understand this condition better. So as we went to break, I mentioned, it is said that it doesn't matter how much a child is affected. It doesn't affect their intelligence. In short, they're still perceiving the world and internalizing it.
Yeah.
How or what does baby Naila love?
Baby Naila loves dancing. That girl, despite her being weak, she dances. She got moves. She has a way of dancing with her hands. Yes. And then when the music gets too nice, she moves the side of her body.
Okay.
She loves dancing. She's a social butterfly. So you can see this is a kid who has a personality, who understands things, and also to show how intelligent she is. Like, Johnny, yes, Papa.
Yes.
You ask her, Naila, this is how she says yes. Eating sugar, this is how she says no. Telling lies, she says no. Open your mouth.
Awesome.
So it shows this kid knows. She can even count for you. Tell her, Mama, count 1. She does this. 2, because of the weakening of the muscles, she goes 2, 3, 4, 5 at once.
Okay.
we go to 6, and then 7, 8, and then 10, and then you have to tell her, good girl, and then she smiles.
We believe that children and people with SMA have an above average intelligence. And essentially, again, it's go back to do with what's been affected. We were at the point of saying it's the cabling, the last mile. But at the center, everything functions as it should. And that's where cognition or intelligence happens. So that's intact. Yeah.
Okay, which now brings us to the treatment and management of this condition. What informs the parameters?
Treatment can be in at two levels. There is a supportive treatment, and then there's the definitive treatment, which is still widely under research. So the supportive management is like what she's mentioned, the ventilator or support to breathe properly, the occupational therapy helping with the muscles and stretching so that they just don't get fixed in joints. Then, of course, the love and care from the parents matters a lot. The definitive treatment is an attempt to replace the missing protein by probably injecting it to the back of the spine. So we know of certain drugs that have been used for that, or doing what we call gene therapy, which is essentially introducing the capability into your body to produce that gene that is missing. And we have candidate drugs that are available, but they're really, really pricey. So one dose of gene, like the drug on asemnogen, is 200 million shillings. And the other candidate that helps to replace the altered gene, risdiplam, costs around 60 million per year.
All right, Ruth, you at some point were appealing to get this gene therapy before she got to 2 years.
Yeah.
You did not succeed.
I did not.
Why were you so keen on getting the gene therapy?
It stops the progressiveness of the muscles. And if given at an early stage, if intervention is made at an early stage, we wouldn't have progressed as much as we did. I didn't even get to 5. I only got to 3M. Yeah, so 3M we used to manage to clear the bills and set up a home ward, and yeah, it was not going to be enough despite how many times I raised it.
Okay.
Yeah.
Dr. You talk about excess of gene therapy, but then again, many cannot afford it. So what are the options, I mean, for these children, especially those with the types that need intervention before the age of 2?
Nothing can be done other than figuring out how else to get you that protein or to get you that gene. The engagement with the various companies that produce this treatment is that they are willing to provide that support to the extent that patients are eligible. Obviously, on a semnogen, there is that cutoff for 2 years for scientific reasons. But then there are other barriers, like you get a drug-free into the country, you still have to navigate taxes and statutory regulations, and you would wish that the government and the various bodies will have consideration for such kind of orphan drugs. We call them orphan because they are for a very specific group of patients. Yeah.
How does it work in developed countries?
Developed countries also are not in one basket. There are those that have a free insurance program for their population, and there are those where the population still needs to fork out money to buy. Now, for these countries, they do not necessarily have access programs, but the government may have provided mechanisms to provide access through various program engagements with the company. Okay. It's still expensive for them.
It sounds like a life where you constantly have to fork out money because of all that is needed for treatment and management.
Yeah.
Are you saying you don't have any support with the insurance covers?
I'm laughing because insurance gives a cut of 300,000 for congenital problems. You've already seen, based on the statistics, SMA is, we call them million-dollar kids. From the caregiving, boiling down to the cost of the drug and every other thing. Especially when you go to the hospital for a pneumonia infection, you won't take 3, 4, 5 days and then you're out. You'll take a month or 2 on, off before you stabilize so that you can be moved to the ward and then home. So 300,000 will not work.
Daktari, at this point, clearly you can even hear the distress this condition brings to the caregivers. Do you consider counseling and just working with them even as they are dealing with this?
Yeah, it's important, first of all, as we were engaging before this, that you help the parents to accept the diagnosis, because that's usually the first step and the first challenge that you get. And then the second bit is really moving with them as they navigate all these clinical challenges. And I always tell them they are their child's first doctor, because they are there with them. They know when they're happy, when they're unhappy. Honestly, most parents, like Mama Neila, are really giving it their all. They're doing a great job. I'm encouraged by the way they understand their kids and identify their personalities and essentially relate and appreciate that this is what I have. And I see there's a move to get teams together, parents together, to encourage each other also, so that they move on with this.
But of course, even with all the optimism of what the child can do and all that, there are people who look at her and wonder, "Ay, kuliendaje." How do you handle this, and what have you heard?
I've heard that it's a generational curse. Nilikosea mahali. I'm Kikuyu, so I was told that there's, I don't know, a part of the body that was not removed, something of the sort, by people weighed down that I need to now go and make amends with the ancestors.
Some sort of sacrifice.
Something like that. I've been told that it's ni mbegu, I need to panda mbegu. Ni madhabahu. Yes, that was the word.
Okay, Daktari, even as we bring a close to this conversation, rare diseases are reality and SMA is one of them. What would you challenge the healthcare system to put in place to support who live this reality?
I think importantly is to develop systems for early diagnosis, to develop capacity, train health workers to be able to support parents and identify the complications that come with the illnesses. I think we need the government to put in more resources for home-based care systems because they can't live in the hospital. And so that's necessary both at home and in the hospital, because if we had equipped government facilities that were able to support intensive care needs, then that may be an easier ride for some of these parents and children.
Your words of encouragement for those who wear your shoes, Ruth?
Never give up. Do it for that kid. That kid is an angel, and one day God will want his angel back, and there is nothing he'll do about it. That is simply how I choose to look at it. Yeah, so never give up.
Very encouraging. Ruth Wambui, SMA caregiver, thank you for being so candid about your journey. And of course, Dr. Sam Guer, pediatric neurologist at the Gertrudes Hospital and also a lecturer at the Kenyatta University. I think today we have a better understanding of what this condition is all about. At this point, we take the health tip.
In this video, I'm going to demonstrate to you a simple exercise that is ideal for anyone who has knee pain or lower back pain. It's called the step back jacks. To perform this exercise, stand with your feet close together, then step back as you raise your arms. Step back to starting position. This exercise activates your quadriceps, the muscles in front of your thighs, as well as your hamstrings and your arms as you raise your arms. So just like this. The idea here is to step back as much as you can. This is much more effective than knee exercises that hurt your knees like lunges and squats. It's very safe on the knees.
I see a lot of your social media engagement. Keep them coming through. And of course, thank you for joining us on another episode of Health Diary. We have been coming to you from the 4 Points by Sheraton. My name is Gladys Gachanja. Until next time, see you. A lot of your social media engagement. Let me do that again. After this fact or the fact. Even ukisema, what have I just said? When it comes to the cake, I sintawachanga. Unaruka kwa